Welcome to the 2021 Heart of Healthcare Honor Program. Nursing is a demanding profession with more challenges faced in the last year than ever before due to COVID-19. Nursing professionals do so much for so many every day. Their impact is enormous, and they are always at their best in the toughest of circumstances. Each year, the community nominates deserving nurses to be honored. Out of these nurses, 10 are selected as extraordinary examples of service above self. 9 of our honorees are chosen by an independent panel of judges from the nursing community, and then 1 is selected by community vote.
Today's event is presented by K&A Greenhouse. K&A Greenhouse is committed to the community and proud to honor this year's nurse honorees.
Thanks to K&A Greenhouses for all you do and your support of nurses, the heart of healthcare. Before we continue, we'd also like to extend our thanks to all those who've taken time out of their day to join us in recognizing these remarkable nurses and to hear their stories. Now for our keynote remarks, we're honored to be joined by Dr. Linda Scott, Dean and Professor at the UW-Madison School of Nursing.
Hello, I'm Dr. Linda Scott, Dean and Professor at the UW-Madison School of Nursing. It is my pleasure to provide comments as a part of this Heart of Healthcare celebration of excellent nurses, outstanding nursing practice, and the expert care and advocacy that nurses provide. I thank madison.com for creating this opportunity to honor the positive impact made by nurses through this profession. It is special that this event is celebrated as a part of Nurses Week. This week allows us to reflect on the vast contributions of the 4 million registered nurses throughout the country. Their impact on health outcomes is worthy of celebration and respect. Nurses Week is also celebrated annually, concluding on May 12th, which is the birthday of Florence Nightingale. Given this, it is only fitting that as I offer remarks honoring the impact of nurses, I will speak to the roles of leadership and advocacy. Both can be traced to Nightingale herself, who modeled these in nursing practice, research, and education to make an even greater positive impact on health. Nightingale described her leadership as being her own purpose, a reflection of her authentic self and unique personality. Her goal was to make a difference to improve health, well-being, and the environments in which people live and work. Now, in 2021, we are still right to emulate Nightingale by leading with purpose and intention and with the same goals in mind. We do so in a healthcare environment that has been described for years as being volatile, uncertain, complex, and ambiguous, and that was before the COVID-19 pandemic took hold in our profession and society. While many nurses were, and still are, on the front lines caring directly for patients with COVID-19, others provided care in different settings. They continue to meet diverse health needs that may seem unrelated to COVID-19, yet in reality, nothing is unrelated. Still, other nurses had individuals in their care who were dealing with the many ways in which the events of the past year indirectly devastated lives. The work of all nurses across all settings was even more complicated due to the pandemic. Yet, in this unprecedented crisis, patient needs continue to reflect the breadth of healthcare events. Mental health care was still needed and provided. Home health care needs were met. Checkups and tests were scheduled, and patients received encouraging health news and troubling diagnoses. The lives of those struggling with substance abuse and addiction were only made more complicated. And there were new lives, aging lives, and the end of lives, all of which needed the care of nurses during the pandemic. As nurses being celebrated here as the heart of healthcare, you know firsthand that nothing in nursing or healthcare has been routine in the past year. Even in settings that might seem far from the front lines of COVID-19, the environment in which care was being sought and provided felt the stresses of a world changed by a pandemic. In addition, it is obvious that we are on the front lines of another public health crisis. Nurses bear witness to the impacts of social injustice and barriers to care and know the negative health consequences that result. We know that in addition to needing care, patients and their families need advocates. Communities and populations need voices. The American Nurses Association considers advocacy a pillar of nursing. Regardless of practice setting, it is a common thread in the profession during all times and circumstances. Nurse leadership and advocacy will be instrumental to healing from the challenges of the past year. Already, with the availability of vaccines, nurse advocacy has included vaccine education and delivery, often to those with the greatest needs, but who face the most barriers. But true societal recovery must include more equitable healthcare systems to meet the needs of populations in our state and beyond. Nurses will be among those who call for and lead in this transformation. In a moment, we will hear about the 10 nurses being honored today. We will learn the stories behind the care which motivated patients' families, and colleagues to submit nominations. It is a joy to hear the words that describe the life-changing impact of outstanding nursing practice and care. These nominations paint a picture of the extraordinary care that members of the community have either received as patients or witnessed as loved ones of those receiving care. It is often said that nursing practice is an art and a science. While the science of nursing, which is the systematic knowledge used to provide quality care, is delivered, it is often the art of nursing that patients and their loved ones so often notice, such as when care is given compassionately, when a concern or loss is being honored, or when a loved one is treated with the dignity and respect they deserve. In the words of Maya Angelou, people will forget what you said. People will forget what you did. But people will never forget how you made them feel. I am grateful for the opportunity to express my appreciation and respect for the value of nursing expertise and outstanding care. Congratulations to the 10 honorees, including 3 Badger nurses who are being recognized. Thank you for the work you do to improve health and health outcomes for all. And thank you again to madison.com for honoring the nursing profession and recognizing these outstanding nurses with awards. I wish each and every one of you a happy Nurses Week, and thank you again.
Our sincere thanks to Dr. Linda Scott and her team at UW-Madison School of Nursing for their unwavering support of our Nurses Heart of Healthcare program. In this 3rd year of this program, we've enjoyed the steadfast support of committed sponsors. Thank you to Children's Hospital of Wisconsin for your help in making this program possible. These nurses' stories are about passion, strength, and we want to thank them for the day-to-day work they do in real-life superheroes. Now's the time to honor the 10 nurses we want to spotlight this year. A huge thanks goes out to the patients and co-workers who honored these nurses, along with the companies they work for, in giving them the opportunity to be a hero in the community. First up, in alphabetical order, is Alana Bender from Tellurian. As a registered nurse at Tellurian, Alana Bender specializes in working with patients who struggle with chronic mental health issues, substance use, and homelessness. It's a field where patients are often stigmatized, a notion Alana works hard to dispel. She says,
"For all the hardship they're going through, all the stigma that there is attached to mental health, they all survive in society, and they all have a positive outlook. It's very humbling."
Ilana describes her job as a gift and considers herself lucky to serve the population that she does. She's a source of hope and optimism for her clients. And they are for her as well.
Our next honoree is Jennifer DiPiazza of A Grace. Stories of patients dying in isolation are among the pandemic's most heartbreaking. Infection prevention nurse Jennifer DiPiazza of A Grace knew that something had to be done. Under Jennifer's calm and data-driven guidance, she found a safe way to allow patients at A Grace to visit with their loved ones and ensured no one spent their last moments alone. Not a single A Grace employee contracted COVID from a work exposure. Jennifer considers helping people die with dignity a profoundly rewarding career. She says,
"I love nursing, I love hospice, I love A Grace."
Mary Jean Urshan Cook of UW Health American Family Children's Hospital is our next honoree. As a nursing education specialist with a focus in pediatrics at UW Health American Family Children's Hospital, Mary Jean developed a program to train pediatric nurses to care for adult COVID patients, as well as a support group for nurses. As she's pursuing her PhD in psychology, MJ hopes to bring a scientific approach to finding solutions to nursing problems. She says,
"How do we positively affect the human connection and really promote resiliency and promote nurses to stay in the profession and to prevent burnout, compassion fatigue, and moral distress?"
MJ says she couldn't have done it alone and calls becoming a nurse the best decision she's ever made. It's allowed her to explore many pathways that have all led to the same destination, helping others when they need it most.
Next up, we have Corey Fink of William S. Middleton Veterans Hospital. Corey Fink has been a registered nurse for 14 years, and for the last 2 of them, he's worked as the nurse manager of the intensive care unit at William S. Middleton Veterans Hospital. He's exceptionally proud of the 16 Madison VA staff members who went on 21 deployments in 10 different locations to support high-need facilities in both federal and private sectors. At his home hospital, Corey saw the need to create a space for nurses to decompress and reset so they can continue to give good patient care.
It's frontline staff being able to talk to other frontline staff about those issues, to talk to people who have actually been there.
A dedicated space for those discussions was up and running at the Madison VA shortly after COVID took hold.
Our 5th honoree is Karen Kraus of Hope and a Future. Even as a child, Karen Kraus recognized the value of intergenerational living. Great aunts and great uncles were a constant presence in her life, as were her adopted neighborhood grandparents. She says,
"I knew at an early age that when you don't have support or neighbors who are there for you, life is not as much fun."
Karen has been a nurse for 42 years, and she's the executive director of Hope and a Future. Hope and a Future is an adult family home that houses 4 full-time residents, 8 intergenerational staff members, some of whom are hands-on caregivers and live at the home with their children, as well as Karen and her husband. Karen says,
"Our staffing motto is a family of friends, and the goal is to support the staff as well as the residents so that everyone has a sense of growing purpose and belonging."
Next, we would like to honor Jen Mora of Stoughton Health. If there's a health-related event taking place in or around Stoughton, Jen Mora has likely had a hand in it. She works as the Employee and Occupational Health RN at Stoughton Health, where she serves as the wellness leader, onboards new employees, conducts health screenings, and organizes and administers flu vaccines. When the pandemic began, Jen went from administering COVID tests to coworkers and their symptomatic family members to setting up community testing sites. More recently, she's been organizing and leading vaccine clinics, ensuring they're adequately staffed and stocked with doses. The sites now administer between 300 and 500 vaccines each week. Jen says the best part of her job is bringing hope to people one vaccine at a time. As different populations receive the vaccine, she has listened to their stories evolve.
There are happy tears, there are tears of relief. People are just so thankful to be able to come in and get the vaccine and try to get back to a more normal life.
Up next, we'd like to introduce Lori Spencer. In each patient, nurse practitioner Lori Spencer of SSM Health Dean Medical Group finds the reason she entered the field and is always building upon her education. She recently earned her certification in psychiatry. She uses data to make the best decisions she can for every patient, and she has an expert team at SSM Dean to turn to.
We're constantly studying and passing articles to each other. We're very actively engaged and always working on improving our knowledge. We don't get complacent.
Lori says that the people she is honored to care for are the best parts of her job.
Number 8 on our list of honorees is Lori TeBrink of Bright Star. Lori TeBrink started preparing for the COVID-19 pandemic years before it happened. After the first case of Ebola was reported in the United States in 2014, she became part of a special pathogens team and learned how to care for infected patients. When COVID emerged, she was ready. Working as Bright Star's Director of Nursing, she oversees medical staffing, 6 home care offices, and 2 senior living facilities. Bright Star's mission is peace of mind, and that's exactly what Lori represents. Lori calls Bright Star's home care nurses surge protectors, who provide in-home care so patients won't overwhelm hospitals. It's work that usually goes unrecognized. She says,
I just feel like I'm the luckiest person on the face of the earth to have this job and to have this impact on humankind in this county and in this state.
Next up is Jody Van Kirk of SSM Health Dean West. In her 40 years of nursing, Jody has had 7 job changes. She'd been a school nurse in the eastern United States and worked in occupational health in meatpacking plants and factories all over the Midwest. But her patients at SSM Health Dean West, where she's been for 16 years, are grateful she landed right where she did. In working with internal medicine patients, she always thinks, if this was my parent, I want to have a hand on my back or holding of my hand, saying it's going to be okay. Over the past year, these relationships with patients, many of whom had been isolated for months at a time, have become even more important. Her patients undoubtedly feel the same way.
Never a day have I thought I wish I would have done something else.
Our final honoree is Kate Walton of UW Health University Hospital. Emergency room nurse Kate Walton gets enormous joy advocating for their patients and their fellow nurses at UW Health University Hospital. Kate has been in the field for 14 years. Working in the ER allows them to meet people where they are. They say,
It's just a great place to be part of people's lives in a very brief way, but in a very meaningful way.
Colleagues say Kate is a fierce advocate who finds ways to act and empower, whether it's for social justice causes out in the community or for issues such as nursing autonomy and fair practices inside the hospital. Kate says the pandemic has reinforced that nurses are the toughest people they know. Even in a difficult year, peaks of hope emerged. They say,
It's inspiring to see the way people can and do look out for each other when given the opportunity.
This is certainly an impressive group. We thank each and every nurse for taking time out of their busy schedules to sit down and talk with us and to share their stories. We are proud to have members of our community shine and take pride in honoring these wonderful nurses for our program.
A special thank you goes out to this year's judges for their participation in choosing an exemplary group of nurses for this year's program. Our judges include Lisa Brodsky, Director of the Undergraduate Honors Program at the University of Wisconsin-Madison, Colleen Gullickson, Professor and Associate Dean of Edgewood College, Carrie Kleminski, Associate Dean of Nursing at Madison Area Technical College, and Barbara Pinkenstein, Interim Associate Dean, Academic Affairs, UW-Madison School of Nursing.
As we wrap up our program, we want to say that so many nurses are deserving of this honor, and we hope you are all proud of the hard work and dedication you have put into your career of service. We are grateful for all those who nominated nurses and to those who have joined us for today's announcement of our honorees. To our participating companies who made this event possible, we thank you. K&A Greenhouses was a valuable partner in presenting this year's awards, along with Children's Wisconsin, who have supported this program throughout the years, and to EPIC, the UW-Madison School of Nursing, and TDS Cares. Lastly, don't forget to pick up Sunday's edition of the Wisconsin State Journal for our special Nurses Heart of Healthcare supplement, saluting this year's honorees.